Plans to reduce the number of neonatal intensive care units in Scotland were announced in 2023. There's currently 8 across the country, providing around-the-clock specialist care for the smallest and sickest babies. But the Scottish Government want to reduce that to 3, which would leave Aberdeen Maternity Hospital as the only unit in the north of Scotland. But a Freedom of Information request by the Scottish Conservatives revealed in the minutes of a health board meeting last year, concerns were raised from some about the plans. In the documents, concerns were raised that NHS Grampian lacked sufficient beds or staff to cope with an increase in demand. It showed NHS Grampian had 28 beds at its neonatal ICU, but would need at least 31 to cover the north of Scotland. It also highlighted the lack of staff at the unit would limit admissions. Today, a cross-party committee of MSPs unanimously expressed their concerns.
The involvement of the parents was after all decisions were made, once the options were decided.
The worries that the committee expressed about the realities of delivering this on the ground are only magnified by the reports that we can see this morning from Aberdeen.
We have got no question that if babies are going to have to be transferred, that babies just are not going to survive that journey. The smallest amount of vibration and noise and lights can seriously affect a baby who's born so prematurely or sick. Star, who are the ambulance service that would be doing the transfer, are absolutely phenomenal, but they've only got so many of those factors in their control.
I recognise the anxiety that's out there. That's why I want to provide the reassurance that this is about saving lives. This is about clinical evidence demonstrating that by moving to 3 specialist units, we are more likely to save lives. The existing neonatal services are still there, and for the majority of babies will still be available.
NHS Grampian says clinical evidence shows concentrating complex care in few centres is the safest approach and improves outcomes for babies due to improved technology and expertise. It also said progress is being made towards the new model, aligning the timings with the opening of the Baird Family Hospital. Gráinne Ní Greathan, STV News.